the most important thing is, and we are working also on an implementation in several countries. I think now the first thing is that you, in a nation or a region, you should get aware that you have to define your target population. So the recruitment is important. How do you do the recruitment? And is the target population really the population also where you can fulfill the eligibility criteria that you need to start with screening? Now, furthermore, what is important that you get together a multidisciplinary team. So not only a radiologist, but also the pulmonologist. You need people that are involved in cost effectiveness, people that know a lot about epidemiology. You need, of course, the people that execute the study, so the technicians, the quality control. So you need to make a team of multidisciplinary team that can act and implement as a lead team the implementation. Now, from there, it's important to define your recruitment strategy. And then it's important that you also define your CT systems where you are going to work with, that also have to fulfill certain quality demands. You cannot do it with every CT, so you have to go through a kind of quality control. And then when you are a bit far that you can really start, then during the start it's extremely important that you can monitor what you're doing. So you build in the whole study feedback with parameters on which you know how good you are working at the moment. So you need your figures on the adherence, of course. If you invite from the population that you invite, will never 100% of the people come. In some countries, it goes down to 50%, which is very low. You hope for higher rates, and sometimes it's even less. So you have to have those figures. Then the adherence is very important. So you do not only a baseline scan, but you do a whole program. And so the early detection only works if you come regularly. In this case, we work with an annual screen like breast cancer, and then you come back every year, by which you get the real impact that you want to have in terms of mortality reduction. But many people, they come at baseline and they stop, and you don't see them anymore. So, for example, there are countries that only 1 out of 4 will adhere to the program. So that is also very important. Now, you have to have figures on your false positive rate. You have on your lung cancer rate. So how many lung cancer do you detect in your population? And that number is, of course, very important. Then you need to have figures on the radiation dose that you use. Now, and so forth and so on. So you have to monitor everything you do. And from this feedback, you get an idea if you are really on the level that you want to reach to get the results that are published so far. So that the monitoring is extremely important.